Hi, I'm Sarah Bushby from Siouxland Mental Health Center, and I get to be here with you today to tell you a little bit about our clinic starting virtual reality therapy services. I want to help you picture a little bit about what it's like. So our clients can enter into a virtual world that feels very much like real life. They use a headset called an Oculus, which is what you see in the picture. It covers their eyes and their ears. And then they get to hold the controllers in their hands. So they can see and hear and feel a variety of sensations as they interact with that environment. The therapist is actually in the room with the client to support them during this process, just like in a regular therapy session. So we can see exactly what the client is seeing by either watching on a laptop or a TV screen, and we're able to be present and guiding them through that situation or the skill that they're working on. And we use the virtual reality as a supplement to regular therapy. It can be a really engaging and creative tool to help clients gain confidence and grow their skills for areas like anxiety or trauma or depression. As we are going into November, we also wanted to touch base briefly on some of the differences between winter blues and when it starts to rise to the level of when we'd be concerned about it turning into more like seasonal depression. So what we start to see this time of year might be similar symptoms for either one. It would be things like your mood might start getting more sad or irritable. Your eating or your sleeping might start to get off track and be either too much or too little. Some fluctuations in those areas are normal, but we start to get more concerned if symptoms are frequent, intense, or if they really start to make it hard to do the activities that are important to you. So some things that we might do in response to that, things that often are helpful in those areas, are looking at making sure that we're getting adequate nutrition or exercise, trying to get some daylight or some time outside, participating in enjoyable things or spending time with friends and families, getting to stay away from electronic use, touching base with the therapist and trying to stick into normal routines. And if you start to see some of the indicators of the more seasonal depression, it could be a good time to give us a call and set up a time to come in and see us. So our contact information is on the screen, and the best number to reach us is that 252-3871. Thank you for having us today.